The 5 Shu points are key acupuncture points in traditional Chinese medicine, TCM, that correspond to different stages of disease and treatment. These points are used to diagnose and treat various health conditions by stimulating specific areas on the body. Practitioners select points based on the patient's condition, aiming to restore balance and promote healing. Each point has specific indications and is chosen according to the principles of TCM. Question 1. What environmental factors most directly impact the 5 Shu points? A. Dietary influences. B. Only internal organ imbalances. C. Emotional stress only. D. Climate and exterior pathogenic factors like cold, dampness, and wind. Question 2. Where does the polarity of energy change from yin to yang or vice versa in the channel? A. At the elbows and knees. B. In the middle of the forearm or lower leg. C. Only at the source, yuan, points. D. At the fingertips and toes. Question 3. What are the 5 Shu points primarily known as in Western acupuncture? A. Source points. B. Element points or command points. C. Antique points. D. Back transport points. Question 4. Between which anatomical landmarks are the 5 Shu points located? A. Only on the elbows and knees. B. Between the fingers and elbows or toes and knees. C. Only on the fingers and toes. D. Between the palms and shoulders or soles and hips. Question 5. What is the significance of the channel progressing in size and depth from fingers, toes to elbows, knees? A. Size decreases as it approaches elbows, knees. B. The channel is deepest at fingers, toes and shallowest at elbows, knees. C. The channel is narrowest and most superficial at fingers, toes, widest and deepest at elbows, knees. D. The size and depth remain the same along the entire channel. Question 6. What is the clinical implication of the instability of energy at the start and end of channels? A. These points should be avoided in acupuncture due to unpredictability. B. The points are less likely to affect the body due to instability. C. These points only respond to internal imbalances, not external factors. D. The points in this section are more dynamic and effective in treatments. Question 7. Which of the following pairs correctly demonstrates the shift of polarity from yin channel to yang channel at the fingertips? A. Stomach 36 to spleen 3. B. Kidney 3 to bladder 10. C. Lung 11, yin, to large intestine 1, yang. D. Heart 7 to small intestine 3. Question 8. How does the inertia of energy transfer between channels at the fingertips, toes? A. The energy becomes stagnant at the junction. B. The energy stops immediately and switches polarity. C. The energy flows backward against the channel flow. D. The inertia continues to flow into the next channel for some distance. Question 9. How did ancient Chinese compare the section of the channel where 5 Shu points lie? A. To a tree growing from a seed. B. To a ladder climbing upward. C. To a river flowing from a spring to a delta. D. To a mountain path ascending steeply. Question 10. Why are points along the section of channel between fingers, toes and elbows, knees considered more dynamic clinically? A. Because they are located deeper and harder to access. B. Because they are unrelated to seasonal changes. C. Because they are less influenced by external factors.